Okay, well, welcome everybody. Thank you for joining us this afternoon. I'll keep an eye on the waiting room and let people in as they arrive. But welcome, I'm Megan G. I'm the Communications Manager for the Community Mental Health Transformation Programme. And today I'm joined by my colleagues Martin Dominy and Justine Williams. And we're going to be sharing with you a piece of work that we've been supporting, looking at improving the information and the signposting that we currently provide across Sussex for when people are seeking support for their mental health. So we've got a really jam-packed presentation for you today, but just to get us started, we've got a little bit of housekeeping just to make sure that we're all settled and comfortable. So the webinar today is being recorded and as usual will be added to the community transformation playlist that we have on YouTube. So if you have any colleagues or friends or family who usually like to tune into these, they will be able to do so after today. That link will be made available. Because it is being recorded, by all means, if you don't feel comfortable having your camera on or would rather anonymise your name, that's absolutely fine. But we do run these more as a meeting rather than a webinar so that people have the option to be able to participate in a way that you can't with a traditional webinar. So feel free to, have your camera on, get involved, feel free to ask questions and use the chat function as well. If you wanted to turn on live captions today, you can do that by clicking on the three dots, which will be on the toolbar of the Zoom screen, and you can then choose captions and then turn those on if that's helpful for you for the session today. There is an allocated time at the end of the presentations for questions and answers. So as questions come to you throughout the session, feel free to put them in the Q&A box, or equally you can hold them until the end, and we'll try to get through as many questions as we can. And then lastly, after the webinar, I'll email everyone who registered to share the recording of the webinar, but also there will be a link to a very short survey that we really appreciate if you're able to complete, because it just helps us to gauge whether the webinar was useful, enjoyable, and it also gives you the opportunity to raise any suggestions that you might have for future webinars. So that's really, really useful if you do have the opportunity to do that. And as I say, all previous webinars can be watched back, which can be found at the QR code on the screen. I'll also share the slides around after the session today, so do feel free to share that far and wide with anyone who might be interested. So that's all the housekeeping. So now I'm going to be joined by Martin and Justine, who are going to be joining me today in leading the session. So Martin, would you like to introduce yourself?
Yeah, thanks, Megan. Martin Dominy. So I work in the Central Transformation Programme team, but also kind of representing East Sussex and Brighton Hove as the transformation lead with Andrea Potter as well.
Thank you, Martin. And Justine?
Thanks, Megan. I'm Justine Williams. I'm Senior Communications and Engagement Manager for Sussex Partnership. I'm also the Communications Lead for the Urgent Emergency Care Mental Health Programme as well. Thanks, Megan.
Thank you both. And Martin is going to get us started with our presentation today. So over to you, Martin.
Yeah, great. Thank you, Megan. So the communication kind of work that we've been undertaking so far, but also kind of want to think about next steps in the presentation today, is really kind of based on that kind of challenge, really. We know for anybody kind of within services or people who have used services either in the past or currently find it really, really difficult to kind of navigate, to know where to go, what to use to receive the right support, and to really kind of just work out kind of what's available as well. So Justine's kind of didn't create, but Justine's found a brilliant slide that really kind of demonstrate there's lots of different ways into services and there's lots of different services available. So we know we got a kind of a real challenge on our hands as well. And I think it's good to also kind of reflect nationally. I think we're on a call with colleagues from Oxford who have found, when they've done this work, there's 37 different referral routes into kind of mental health support as well. So it kind of is a national issue as well. But for Sussex, we really kind of think it's fundamental how we kind of change and improve services. We've really addressed this challenge as well. Thanks, Megan. So we're hopefully kind of the impact of kind of people not going to finding the right information or being able to access services kind of quickly succinctly, but also kind of also families and carers as well, that it can kind of lead to kind of more people experiencing kind of mental health crisis. And we know that puts a lot of pressure on some of the emergency and crisis services as well. And obviously it's very distressing for that individual going through that process as well. We know that we kind of get increased calls to kind of A&E, people calling 999, and obviously also just kind of finding themselves at the wrong point of kind of the services that can help them in that time as well. And then ultimately, we really want to kind of tackle the kind of the number of people that are actually admitted into hospital or kind of waiting for hospital beds or waiting for discharge as well. So we know it's a real important piece of work that we're trying to achieve as well. And that's what it's been really, really pleasing to kind of have Justin and her side of their kind of urgent and crisis kind of services as well, working really closely with the community transformation programme. Thanks, Megan. So we've set up a kind of the communication working group that's been meeting for about 6 or 7 months, I think, as well. And it's a real kind of collaborative kind of meeting. So we've kind of got people from the NHS, the Trust, from clinical services, local authority, and from the VCSE partners as well. And we've also kind of been really encouraged and really supported well by people with their own lived experience as well. So that's been really pleasing. So it's a really kind of coming together as a joint system to kind of really address this joint issue, kind of squarely in the eye really, and to think about how we can kind of take and resolve some of these issues. Thanks, Megan. And I think this is just a representation of the kind of different partners and different people that are involved in the programme as well. What we are finding really, really encouraging as well, that we're also kind of encouraging we're also in kind of including different people from different parts of the system. So we're also kind of having a lot of interest from kind of young people services as well, that are really kind of keen to kind of work with us, but also some of the specialist pathways. For instance, eating disorders are actually kind of like really trying to link up to what we're doing, what they're doing, and making sure that we kind of do this once and we do it really well as well. So our approach has been really kind of to make sure that we have a really well-informed intelligence and insights as well, that we kind of really kind of wanted to make sure that we really kind of represent the views of people using services, family carers, and also service providers as well. We've mentioned kind of Justine and the kind of great work that they're doing over there, and we really want to kind of make sure that we kind of build and maintain those links as well. And we've really kind of worked hard to make sure that we kind of really kind of address and really kind of are aligned to some of those key outcome measures within the wider programme as well. And that's from the kind of crisis and emergency care around the reduction of people going to A&E by 20%, but also we increase with the 5% year on year, people accessing mental health support across the community services as well. So we're always very mindful of some of those real kind of key deliverables that all the programmes are trying to achieve as well. Thanks, Megan. I think it's over to Justine now.
Thanks, Martin. So as Martin described at the start, the challenge we wanted to address as a working group is that people find it hard to find and access mental health support and services in Sussex. And, you know, we know it's a really confusing landscape, and, you know, this means that people may not be getting the help they need, you know, at the right time when they need it. So to get us started as a working group, you know, we wanted to set out a bit of a roadmap, like, you know, what was the approach we wanted to take as a working group to improve that situation. So starting at the bottom, as Martin's just referred to, we wanted to make sure that we were taking an insights-led approach to understanding what the problem was and what we could do to improve it. Combined with taking a collaborative approach, you know, so working with partners across the Sussex system and people with lived experience as one team to sort of co-produce the approach to that solution. Next, we identified, you know, some key outputs or objectives for the working group. So firstly, to make sure that we develop clear and cohesive signposting across the system to make it easier for people to find and access services. Secondly, we recognise that there's a need to understand the other factors that can prevent people from accessing mental health services and lead to health inequalities. We want to make sure we better understand and address these. Now, these additional factors aren't included in the research that we're going to be sharing with you today, but they are, a work stream for the working group that will be picking up further, later this year. Third output is to make sure that we understand how and when people seek help with their mental health, so that we can design campaigns and communications that reflect this insight and are designed to encourage people to seek timely help. We know that people don't always seek help when they need it at the moment, so really understanding that behaviour is absolutely key to us sort of improving our communication and campaigns to encourage people to do so. And as a result, if we get those bits right, then, people in Sussex should know how and when and feel able to access help with their mental health. And the outcome of this will be that people get timely and appropriate help and support with their mental health. Next slide, please, Megan. And in contrast to that earlier slide, or that earlier image that Martin shared, which was the very confusing signposting, which I think was from Ireland, this is what we're aiming for. So just sort of contrast. This is a sign from the A40, I believe, which just sort of is, as you can see, much clearer. And this is what we're aiming for as a group, obviously, just to make it a lot easier for people to find what they need. Next slide, please, Megan. So last summer, we commissioned some research to help us understand the barriers that are preventing people from finding and accessing mental health services and the opportunities to improve on that. So we're just going to take you through those research findings. Thanks, Megan. Next slide, please. Oh, yes, here we are. So first, just to explain the methodology before I hand over to Megan, we started with 8 stakeholder interviews. So these are stakeholders representing the different parts of the Sussex system. So that's primary care, mental health urgent and emergency care, local authorities, our VCSE partners. We spoke to someone from the Sussex Mental Health Line. It gets lots of calls every day. Representatives from adult services and secondary care, CAMS, and the 16 to 25-year-old pathway. Now, we know there are lots of other stakeholders across the system that we would have loved to have spoken to as well, but we were limited in terms of the number of stakeholder interviews that could be carried out. But this gave us some really rich insight, and we wanted to explore with stakeholders what they felt the issues were and what those opportunities to improve could be. The second stage was to carry out a survey. So we designed and distributed a survey, and thanks to our partners who really helped to share it with their networks, we achieved 338 responses. So really good response to that survey and some really rich insight from that as well. And we also recruited a small number of people who completed the survey to take part in some depth interviews. So these were interviews that were carried out virtually or by telephone, and were an opportunity for the researcher to kind of explore in more depth some of the answers to the questions in the survey. So I'm now going to hand you over to Megan to take you through the results of the research.
Thank you, Justine and Martin. Oh, am I off mute? There we go. Thank you so much. So we're going to share some of the insights with you, so what the insights told us. So within the stakeholder interviews that were, of those 8 stakeholder interviews that were conducted at the beginning of this process, there was a general consensus that there is a real widespread lack of awareness around the range of support and advice available, which in itself then creates a barrier to people being able to access the support and services they may need at that time. There was also an acknowledgement within that quite often professionals working within the system feel that they are signposting people to the wrong service, but it's perhaps in absence of knowing what the right service is instead. So that can be frustrating for them, obviously wanting to help the people that they're working with and patients, clients, to be able to seek support, but not really knowing what the right place is to direct them to. And there was also something around how finding and then using the right door, so the right place, is not easy, because there's a real lack of consistency around the information and the way that we present that across the different partners and organisations that we have in Sussex, who all provide obviously different parts of this system. There was also acknowledgement that some of the barriers that are occurring at the moment is that inconsistency in the way that online we are presenting and describing services and the support that is available, which can make it really confusing, because we're all slightly saying something different. And that there's a lack of a kind of visual identity or a brand as such to help bring all of those services together in a way that feels consistent, and that there's at times a lack of understanding about where each of these services sits, because the health and care system in Sussex is so vast and is quite complicated. So it can be quite difficult for people to know kind of what sits where and which parts are linked to the other, and that can also be a barrier. There was also something around the way that we as a system currently describe services and support options, and that they're very much focused around a service name rather than what a service does, or what a person might be experiencing, or what they might be seeking help for. There's almost an assumption that a person would know what a service would be called. So that can also act as a barrier for people being able to identify what would be the right place for them. And then also the jargon, the amount of clinical language and jargon that we use within health services, which can make it very difficult for people to know what we're talking about sometimes, which can then again act as a barrier to people being able to access information and then in turn support as well. So thinking about finding and accessing support, we asked people to reflect on the most recent time that they tried to access either information or support for their mental health, and what their experience was like. How easy was it? And nearly a quarter, so 24% of the people that we asked rated it as 1 out of 10, so the lowest that it could have been. So it was absolutely not easy for them to find what they were looking for. So that was, quite a significant reminder of the importance of the work that we're seeking to do within this project. We asked people to share with us where they currently go to find information or support for their mental health, and the two that came out as the highest were people using online searching to find information, and the other was going directly to their GP to find out, where would be the right place for them to go and to be signposted from there. So we realised that these are two areas that we really need to be focusing our efforts on to be helping the most people, because that's where people are going. There was also an acknowledgement that even if people know which service they need to go to, or if they're currently accessing a service, they will also use online searching to help support that. So we need to make sure that there is, useful information and tools and resources available as people are seeking that. And then looking at the services that we have, which people can contact directly, we asked them which ones they're going to, and the ones that came out highest were the Sussex Mental Health Line, Health in Mind, which is the NHS talking therapies for anxiety and depression in East Sussex, and CAMHS. So that was really interesting for us to see, who are people contacting at the moment. So we then wanted to find out what it is that is making it very hard for people to be able to find the support that they're seeking. And again, it was that acknowledgement that the information that we're providing is unclear and can be very confusing. So, the number of organisations and charities that we have within Sussex, we are all presenting information about mental health and services and support options, but we're all saying it slightly differently. So it becomes a bit of a roll of the dice as to the information that someone might get, depending on where they happen to go to. And that people aren't always sure what they need support for. So I mentioned before about often the way that we group our information is based on service name. So there's an assumption that people will know what that service does, but actually someone might want to say, I'm looking for information for anxiety or an eating difficulty. And instead we could then say, you could contact this service, or there's this voluntary sector organisation, or there's this group. So instead of it being a list of services, it could be more helpful for people to be able to describe how they're feeling or what they're seeking support with, and then be able to make an informed decision from there. And there was also something that came up, which I think was really important for us as a working group to recognise, that people who have accessed mental health services or support previously have got that prior knowledge and understanding of the way that our services are made up, and the sorts of words that we might use and the sorts of things that we call our services. So actually, it's often people who have used services before that have kind of a better chance of finding the information they're looking for, because that they have that experience. But actually, for someone who is looking for information for the first time, the way that we're providing that information isn't really tailored to them. We're assuming that people have that prior knowledge and understanding. And as we know that, you know, there are many people who will be seeking information for themselves or a loved one or a friend for the first time. So we've got to really consider that group. And then we ask people what it is, or what are some of the things that we could do that would make this easier for them to find the information, or in turn the services that they're seeking. And it came out very clearly that people really want to be able to speak to a person that can help them get to where they need to be. So a system navigator of some kind, somebody that they could say, okay, I'm experiencing, I'm not sleeping at the moment. I've also got concerns about my housing. And I've also been having, some, anxiety. And they'll be able to say, okay, right, so I think that you would need to be referred, or I can put you in touch with this service or this person or this group, and help them to get to where they need to be. So that was something that was suggested. Also, just having clearer information on the services and their offer. So which services can people refer themselves to? Which services need to be referred by a GP or a professional working within the health and care system, so that people can be really, really clear, and we're being really upfront and transparent about what the services are and if they can be accessed or not. And if in fact they can't be, which ones can, so that people can then make a decision and a choice that is right for them, rather than trying to access a service that isn't going to be possible anyway. And then again, linked to that, clear and more accurate signposting and referrals. So again, just being really clear about what the service is, how to access it, who it's for, so that people have the information they need, rather than trying to access something that isn't going to be suitable for them. And then again, that support to navigate our quite complicated system, and help just to understand how the different services are made up and how they link together, and particularly if somebody is seeking support from different parts of the system, and how do they connect, how do they kind of talk to one another, so it doesn't feel like separate things. And then after having looked at accessing information, we then wanted people to share with us what it is that makes it challenging for them to access the support. So they've found what they're looking for, but then how do they get the help they're seeking, and what is it that's preventing them from doing that? A number of people said that it's not finding the support that's an issue, but it's accessing it. So because of long waiting lists or long hold times for things like the Sussex Mental Health Line, that is acting as a barrier to people getting the support they need. And that there's often a lack of communication between the services. So I know, working within the community transformation programme, that's something that we've heard a lot in the, the various engagement work that we've done. People don't want to have to keep repeating themselves over and over again. Why can't services just join up better so that we are working together, so that people can have a more joined up approach to their care. And then we asked them, so what would make it easier to actually access that support? And again, it's that clear information about services. So who is it for? Who isn't it for? So people can decide if it's for them and how to access it. Shorter waiting times, which was important for us to include within this, though it wasn't considered as part of the scope of this specific project. But we wanted to include it here because we are hopeful that by helping people to get to the right service for them first time round will hopefully have a positive impact on waiting times, because people will be waiting for the service that's right for them rather than being on a waiting list for a service that isn't appropriate for them anyway. So it's important that we include it on here, though it wasn't the kind of the planned kind of scope of this work. Again, that support to access the services, so that help around navigation, and someone that can just help them get to where they want to be, where they need to be. And for there to be more referral options, so could we look at opening up self-referral options for more services? And again, that wasn't supposed to be in the scope of this project, but we obviously working very closely with colleagues in different parts of the system and different transformation programs, and sharing this insight work with them so that they can then see that actually this is what our communities are asking for, and whether we could consider opening up more self-referral options to help people get support. So I am now going to hand over to Justine, who's going to talk through the recommendations of what we're proposing we do next. Now we've got the information. Thanks, Justine.
Thanks, Megan. So just to sort of summarize, there's 4 kind of key recommendations that have come out of those insights. The first one is about how we sort of present information online, that this needs to be more clearly presented, with a focus on the conditions that each service supports, as Megan said, it was sort of really clear that people find it very confusing what the services actually offer, who they're supporting when they are just described by their service name. So being much clearer about the conditions that each service supports is really important, and also being clear on the required eligibility for the criteria to be able to access support. So just making sure that it's very clear up front, who the service is for, who it supports, what the conditions are that the service supports, and what the eligibility is for each of those services. Secondly, this point around GPs is absolutely clear. We didn't actually identify this when we were sort of mapped our initial sort of theory of change, but this is a sort of a clear insight that it's not just the public who are confused about how to find and access services. GPs and other professionals are too. So GPs are a really important access point for people who are needing to get help, particularly first time, with their mental health. So making sure that GPs and other health professionals, and other professionals, I should say, are fully aware of all the pathways and who to refer patients to in different circumstances. The third point here, similar to as Megan was describing about waiting lists, is kind of, this falls outside of the scope of this piece of work, but it came through quite loudly in the research. So therefore it's been included as a recommendation that where appropriate, there should be an opportunity to open up referral options for services that don't currently allow self-referrals. So I think it's the point being that it's, sort of there's quite limited self-referral services at present, so more opportunities to open up services to allow for self-referrals is sort of something that would be supported. And as Megan has talked about, in terms of the sort of system navigators, so having potentially a trained, individual or service whose role it is to help signpost and help people navigate to the support they need. So I'll move on to the next slide, please, Megan. Thank you. So there's obviously clearly a lot of work to do. We had a meeting as the working group last week. We came together in person just to reflect on the insights again, and just to really think about what those next steps were, where we want to sort of focus our efforts and sort of take forward those recommendations. So we've agreed a number of work streams. So there's 4, but prioritising 2, which are, the first one being the public-facing communications. So working together to achieve consistency in how and where we signpost people, how we describe services. So taking on board this point about thinking of helping people to find services according to how they're feeling. And working together to explore opportunities and develop a central point of information. So this is something that would be accessible by the public and professionals as well, but just making sure that we have that consistency across the Sussex system to be able to help people find the help they need. The second priority work stream is engagement with professionals, as I was just referring to. So GPs, as a primary audience there, but also sort of wider partners as well. So as well as healthcare professionals, Sussex Police, CCAMS, local authority, frontline workers, all absolutely key audiences for this, just to make sure that everybody kind of understands how to signpost people, if they're likely to be in contact with people who might need support with their mental health, just having that knowledge or knowing how to access that knowledge for these different groups is absolutely key. So for those 2 work streams, we're going to be establishing task and finish groups with a timeline for working against some clear objectives for the next year, but really prioritizing initially for that first for the public facing communications, how we achieve that consistency in how to sort of signpost. So making sure that if you go online, you're not sort of seeing multiple different websites presenting slightly different information, but getting to a point where we are all saying the same thing, and just to make it easier for people to get help. Phase 2, we will be looking more at this point around sort of access and navigation. Now, in the working group meeting last week, we discussed, obviously, this was a clear insight, something that people told us very loudly and clearly that they wanted, but we were also a little concerned about the unintended consequence of creating a role for or a service whose responsibility it is for sort of system navigation, and we feel it's more important that there's a collective responsibility for holding this knowledge, rather than it being one person or one service which creates then a new waiting list for people to be able to access a service. So it's something we will continue to explore, but once we've sort of focused on those first 2 priorities. And as I mentioned earlier, the other factors that can prevent people from accessing mental health and resulting in health inequalities in Sussex is something that, although it's in phase 2, that's because we are looking at, potentially commissioning some further research to inform, our understanding of this. So we will be, early on this year, sort of looking at what we know, what we need to know, and looking at what resources we need to be able to take this forward. So this will be a priority work stream for us for this year as well. So I think that brings us to the end of the work streams. Thank you, Megan.
Thank you, Martin and Justine. We are now going to come into the Q&A section of our webinar today. So if you do have any questions, please feel free to put them into the Q&A box. Or if you use the raise hand function, we'll then be able to come to you and you can ask your question directly to us. Okay, we've got a couple of questions in the Q&A box here. With regard to the public-facing communications, does this group have involvement from staff who work within operational services? And what checks and balances are in place to ensure the information going out is accurate? Who would like to answer that one?
Will I take that one, Megan?
Yeah, sure. Thanks, Justine.
Okay, yeah, great question, Louise, thank you. Yes, we will have, we're just in the process of pulling together the membership for the Task and Finish group. So, and yes, we certainly do envisage that having, representation from staff, as well as, communications professionals. And obviously key to that is coming together to determine what is the accurate information, where do we want to be signposting, people to. So yes, we will be we're working with partners to sort of ensure the accuracy of that information, and sharing that with our partners as well, just so there'll be an opportunity for people to feedback and reflect on kind of what information we would like to include in that, and just to make sure that is reflecting the most accurate information.
Thank you, Justine. Mel, I can see you've got your hand up. Would you like to ask a question?
This is a complete perfect explanations of what I hear from my constituents on a regular basis. And one thing, just so I don't step out of line, because they're wondering if their voices have even been heard. If I can say this is actually being spoken about, it's going to be addressed, but it's not going to be just jumped. So things are fully assessed and understood. Because to pass on this would be excellent, but it's not of great enormity to you. It's not only patients, staff as well have the same theories. And actually, the beautiful thing, you've been saying exactly the same things as the patients, the carers, and the staff. And they all believe it's, oh God, the GP needs to know more, the poor thing. But then they have a starting point. And so to be able to tell them this, that things are being looked at and spoken of and not just left. If that's possible, then drop me a quiet email, and don't worry, I'll keep my mouth zipped otherwise.
Thank you so much, Mel, and it's really good to hear that that this piece of work is obviously welcomed, and yeah, we're really excited about it, I think, within the group, and really believe that it has the potential to make some real positive change.
The EBE could be a very, very strong force for you. When you're talking about support and directions to go, then they would very, very much support you, just so you know. They wouldn't, we've got a very strong workforce in our EBE, and they definitely want to stay assisting the trust. So now I'll put a tip on it, but
no, not at all. I absolutely agree. And we do have some expert by experience representatives within our core working group, as we absolutely recognise the importance in their input in helping us develop this work. So absolutely. And just to your earlier point, we're really keen, obviously, for this work to be shared far and wide. So if there are particular groups or meetings that would be helpful for either myself, Justine, and or Martin, all of us, to come and share what we're doing, then we'd be really happy to do so. So do feel free to email me on the community transformation email address, and we'd be happy to line that up. Thank you. Martin, did you want to come in on that point at all?
Yeah, it's just to reassure Mel. So there's 3 place-based meetings that take place around the transformation program. So this kind of work is going there, and each one of those place-based kind of meetings has the local league groups or the lived experience groups as well. So it's kind of finding its way through those guys as well, and obviously taken back to their teams and networks as well, and then we're kind of getting feedback as well. So yeah, we really are really committed to kind of keeping that going, that communication and that consultation going. And I think in a way, I think it's what first inspired us to do this bit of work, really, knowing the frustration that people feel when it's not clear, it's not accessible, it's taking people time, and it's actually making things more difficult for people. So that's why we really wanted to get on with this bit of work, really.
Thank you, Martin, and thank you again for your question, Mel. I'm just having a look at the Q&A box. We've got lots of questions coming in, which is great. Alice has asked when we're looking to start phase 1, as you'd really like to be involved in the Task and Finish group. So absolutely, Alice. What I'll do is I'll reach out to you and let you know that we're looking to set up the Task and Finish groups in the next week or so, and we're just pulling together the membership. So I'll get in touch with you, as you are very, very welcome, and it'd be great to have you involved. There's also a couple of messages here from colleagues who work in roles that help support people to get to where they need to be. So Marie, you said that you work as a mental health care coordinator for a GP surgery, and you help support patients access the right services, complete referrals, navigate support, and you'd really like to be involved in the development of roles similar to mine. So that's fantastic, Marie. If you're happy to, would you mind, actually, no, I'll have your email address from registering for the webinar. So I'm happy to reach out to you if that's okay, so that we can hook you into the access and navigation work that we've been looking at for phase 2. That would be really, really helpful. And Louise has also mentioned that GP surgeries, a lot of them have social prescribers as well, which also help people to access both services, but also local support that might be helpful for them. So is there something around explaining that these roles are available? And that's a really good suggestion. That might be part of, you know, a future campaign or work that we develop to make sure that people are aware of that role, where they're available, and how to obviously access them, because we know that that is obviously a role that a lot of people find very, very helpful. Sarah has also asked a message about where do we envisage we would post consistent online information for service users and staff to cover the whole spectrum of mental health and services. Would it sit on the central NHS Sussex website or somewhere else? And wherever that might be, will there be obviously a budget required to do this? And if so, where would we obviously get that from? Justine, did you want to come in?
Sure. Yeah, great question again. So I think there's well, the budget question is one that we're going to be asking at the Task and Finish group. I think Alice also asked a question about budget as well. So that's to be confirmed. But in terms of where the online information will be posted, I mean, I think the vision is that all partners will have very, similar information on their websites, or the same information on their website. So that's the ideal. But we are also looking at this kind of central source of information. So, that's somewhere that we can signpost people to, and professionals to access information. So I think it's getting that consistency in signposting, how we talk about services, which services we're signposting to, which is information that's shared across all of our partner, online, also any sort of online presence, posted out on social media, on websites, etc. But then looking at this central source of information as well. But again, this is something that's really got to be teased out of the Task and Finish group about, how we do this. But that's kind of the vision of where we want to get to at the moment.
Thanks, Justine. Martin, did you want to add anything?
Yeah, it was just around the funding really, and I think that's probably why we've kind of taken the approach we have, that we need to make sure that we've kind of got well-researched, really good coverage in terms of that intelligence and insight to base our decisions on further down the line, because this will have to be kind of signed off at quite a senior level. And but we really do recognise it will need resources, regardless of where it sits. But we do need to make sure that there's a resource and kind of input into making sure that things are up to date and they're relevant, because things do change quite a lot across the sector as well. But they're also kind of really responsive to kind of what people are feeding back about what the needs are, whether, there's kind of reviews within that, or how we can do it better as well. So you recognise that ultimately they will be. But it's also, that's why we really want to encourage people to get involved, isn't it? To help us make that correct decision as well. So, we do kind of really open our arms to people's comments and feedback, or if they've got time and capacity to kind of get more involved in what we're trying to achieve.
Thank you, Martin. Absolutely right. So similar to what I discussed with Alice, you know, if anyone is interested in any of these groups or thinks that you may have a colleague or someone in a network or a group that you're involved with that might want to also get involved in one of the Task and Finish groups, do get in touch with us, because as I say, we are only just forming those groups, so it's absolutely not too late, and we want to make sure that we've got the people round the table that should be there and want to be there and help contribute to this. So yeah, do get in touch with us if you do want to. We've got a question here from Carol. Just if we can confirm what the timeframes are that we're envisaging for phase 1 and phase 2 to be completed. Justine, did you want to come in to discuss the timeframes?
Yeah, sure. So we're working to, so we've kind of mapped those phase 1 will be kind of, you know, within sort of Q1, Q2 of this year. That's the intention. But again, you know, we do need to put the meat on the bones, you know, in the Task and Finish groups and sort of map out what is achievable. But we want to move quickly. You know, we think there are some things that we can do kind of now. There are some things that are going to take a little bit more time. So we'll be mapping out what that work plan looks like. But, you know, certainly the intention is that we will start to see things happening fairly quickly. And then, you know, phase 2, you know, again, we're looking within within this year. So second half of this year, potentially with funding, you know, commissioning further research if we need it to understand those factors that are preventing people from accessing mental health services, and further exploring that point, that, you know, the work stream around sort of access and navigation. But, you know, certainly our timeline is all within this year, but looking at getting things up and running and delivered as quickly as possible.
Thank you, Justine. So I don't know if anyone else has got any more questions or wanted to add anything at all. I think we've answered everything that come into the Q&A box. So any final thoughts? No, I think we've covered everything. Okay, well, I can give you all back 10 minutes in your day. Obviously, firstly, a thank you to Martin and Justine for joining me today to share this work. Thank you to everybody who has joined us and taken the time to listen to the work that we've been doing. Very much again encourage anyone who'd like to get involved in this, do get in touch with either myself, Martin, or Justine, as you are very, very welcome. And yeah, we really obviously want to make sure that what we end up developing is really useful and makes a positive difference to people's experiences. We'll be back again for our next webinar on a slightly revised date. It's going to be the week after than we usually do. It's going to be Wednesday, the 28th of February. So it'll be midday. And we're just finalising the programme for that. So topic is to be confirmed, but we will be here. So yes, do sign up for that. It'd be great to see you all. And thank you so much for coming. I'll send around the slides and the recording once it's available. So do share that with colleagues, networks and groups that you're involved with, as it'd be really helpful for more and more people to know about this work. So thank you so much. Have a good afternoon and we'll see you soon. Thank you. Bye-bye.